experience for you and your viewers. Choose who can participate. Set a delay between message. Hide or put people's in timeout. Manage message, left for reviews and moderators to your channel. I'm going live for people to see me. So I'm going live for people to see me. I'm not going live so that people will not see my face. So in this channel, like if you go through the channel, I talks about health generally. Mhm. I talk about health. Basically now I focus only on diabetes, but doesn't mean that I'm going to focus on diabetes forever. Okay. Why did I focus on diabetes? Is because I want to educate people. We have a lot of people. I'm a medical lab scientist. So I have a lot of patients which are suffering from those conditions. I see them every day and I attend to them. You know, I later discovered, based on my study, I later discovered that some of them were ignorant of what is actually affecting them. They are not well informed regarding to what is affecting them. If, for example, 10 people visit my office a day and five of them are diabetics, and inside five of them, almost four of them don't even know what actually is diabetes. They don't know how to manage it. Number one, they don't know how to what medication should they take. They don't know when to take the medication. They don't know what types of food they will eat. And the rest is the case. So, in such situation, in such situation, I tend to see that, and I've seen a lot of patients which have died because of this. So I tend to see that the most important things I can do now is to create awareness regarding to this because people should not be dying because they are diabetics. Hmm? Diabetes is manageable. You can manage them until when God call you. So shouldn't people shouldn't be dying. Yes, it's congenital. That is, it doesn't have permanent cure, but it can be managed. Some of the way of managing diabetes is for you to know the kind of food that you eat. That's the first step to managing diabetes. The first step, yeah, the first steps in managing diabetes. The first steps in managing diabetes is to know the kind of food that you eat. Food that you eat. The first step to manage diabetes. And the second step is to make sure that you visit your doctor regularly. And I will advise you to have these glucometers in your house, in your room, so that when you notice some changes in your body system, you check it yourself. If there's issue that you can, you know, address immediately within your power, you do it before visiting your doctor because there's some time when this blood sugar is high and your doctor is far away from you. Before you get there, it might affect you. It might collapse on the way. Yes, it might collapse on the way. This is the effect of diabetes is that it affects the nerves. When it affects the nerves, that's why some people, when they have some little injury and the injury becomes a big sore, at the end of it may even lead to amputations because the nerves have been damaged, most especially the feet. When its nerves is damaged, even when you have little some of injury, you will not notice it because you're not going to feel any pain. So, and another thing of diabetes is that it affects your eyes, your eye. These tiny blood vessels in the eye that make you to see supply blood to the eye. When someone is diabetic, it destroys that nerves, and when that vein is destroyed, you'll not be able to. It's going to affect your eye, and when eye is affected, that's a permanent damage that you may never see with that eye again. So that's one of the effects of diabetes. You know, diabetes sometimes may affect your kidney. Okay. Because when there is excess concentrations of glucose in your blood. What the kidney does is that it helps to process and extract those sugar from your body system. The main reason why you go to bathroom frequently for urinations. That's the main reason you often visit your restroom for urinations. It's because your kidney is trying as much as possible to process and bring out those sugar which your body does not need. At the end of it, yet you end up giving more works to the kidney. So it does affect the kidney. Now, how do we manage these diabetes of the teens? How do we manage it? Because management is the first thing. Okay, management is the first thing, like I said earlier. You can manage diabetes. Number one, monitoring. Number two, the kind of food you eat. Also, you can use herbal remedy to also manage diabetes. What I mean by herbal is not just like herbal like this, but some of the spices, natural substances we have in our environment, it can be used to manage this diabetes. Like you have turmeric, you have cinnamon, it can be used to manage diabetes. Position, these and a natural sweetener, cinnamon can be replaced if you like sweetening something and you are diabetic, so you cannot use sugar, so you can substitute it for cinnamon. And another question which is some of my followers on TikTok ask is this is can a diabetes eat cocoyam? Yes. Cocoyam contain low glycemic index. What about low glycemic index? That it not digest quickly. So cocoyam contain low glycemic index. So if you are diabetes, you can eat cocoyam. And one thing also you got to understand is this. You see the diabetes of a teen, the sugar of the thing we're talking about in our body system is it has a high when you have excess fat in your body system. That fat can be converted to sugar. That's what we call gluconeogenesis. Gluconeogenesis is a medical condition or is a condition where body regenerates sugar in the absence of normal sugar in your body system. You generate sugar from protein, excess proteins that you have in your body system. So it doesn't mean you stop eating sugar completely. You are not going to, your body is not going to, the sugar is not going to rise. But you stopping sugar, it limit at the rate at which it goes up. So gluconeogenesis is also involved. That's why some people they say I've stopped eating everything. Yes, like one woman that came to my office this morning, Eribo Victoria, that's her name. She complained when we did an investigation. Her sugar is 205, and according to her, she have restricted herself. She eat unripe plantain, she eats wheat, and some other things. She eat them, but exclude these bread and other sorts of carbohydrates. She has excluded them. The drinking she don't drink all those minerals. She does not take them anymore. Yet the sugar is still going up. The reasons is because of this gluconeogenesis. Gluconeogenesis. So what do you do in this process? Number one, there are three essential vitamins that can also help you rearrange your body system. Three essential vitamins that if you have diabetes, you should be taking. This also will help boost your immune system, boost your insulin that can help crack down the glucose. This essential vitamin, number one is vitamin D. Vitamin D, we got vitamin D from sunlight, right? So the vitamin D's are gotten from sunlight. Early morning sun from that of 7 to 8, 9 a.m. is very good. You can take a walk inside those to get vitamin D. There are other substances that can give you vitamin D. So if you are diabetes, vitamin D is very, very important for you. Vitamin D is very, very important. And secondly, we have vitamin B12. Vitamin B12, the essence of vitamin B12 is that it can help regulate your sugar level. This nerve damage, when you are taking this vitamin B12, it can also help to rearrange your body system. The numbness of that is numbness, the damage of this nerve system could lead to numbness and other situations whereby it can lead to amputations if it's not properly managed. Vitamin B12 also is good for it. So you can use the supplement if you cannot get it from any other source, maybe you can use the supplement. And the third on my list, the essential vitamin, is vitamin C. Even orange contains a lot of vitamin C. So vitamin C is also essential. If you are diabetes, it is good and it helps to arrange your body system. And also, some of the lifestyle we find ourselves can also contribute to this uh, diabetes complications. Some of the lifestyle, like too much sleep or eating heavy food at night, at maybe around 10 p.m. You have not eaten. Immediately you just eat a heavy starch or whatever, you go to bed. You need less food at that time because you are not going to work, you are going to sleep. So eating less food will give your body ability to process and digest quickly. Eating heavy food, you add more. That's why if you do monitor your body system properly, you find out that when you eat heavy food, when you eat heavy food in the night, you wake up in the morning look so tired. So eating a lot of food in the night, maybe after 10 before going to bed is very, very dangerous for diabetes. Very, very dangerous. And also lack of exercise. mm, Lack of exercise. If you're diabetic, the importance of this exercise is help to crack down or break down some of those substances in your body system, glucose in your body system. So you need exercise. You need exercise. Either your home chorus or even gym. Go to gym. Exercise also help to break down the glucose in your body system. So don't just sit down in a sedentary way. That also contributes to diabetes, most usually if you are obese. So that is what I have to discuss with you in this live sections. I believe if you see this video, you have learned one or two things. You learn one or two things, and I believe that whatever thing you learn here, it's going to have a significant impact on you. And if you have any question regarding to what I've just said, or you have any question regarding to health, you can drop in the comment sections. All right, you can drop it in the comment sections. I will reply you. So I'll say bye for now. See you in my next video.